Welcome to our presentation on dietary diseases. Today we will discuss these diseases, their dietary causes, symptoms, remedies and potential fatality. Let's begin. Coronary heart disease is primarily caused by a high intake of LDL cholesterol and trans fats. Symptoms include chest pain, shortness of breath, fatigue. Remedies include reducing intake of saturated fats and opting for lean meats and low-fat dairy. It is a high-risk disease if not managed properly. High blood pressure is often linked to high sodium intake. Symptoms can include headaches, shortness of breath, dizziness, but many times there are no noticeable symptoms. Reducing salt intake and opting for fresh foods can help manage this condition. Left untreated, it can lead to fatal heart disease or stroke. Type 2 diabetes is a common disease that's largely triggered by high sugar intake. Symptoms include increased thirst, frequent urination, unexplained weight loss, and fatigue. Reducing sugar intake and exercising regularly can help manage this disease. If not managed, it can lead to fatal complications. Obesity. This is caused by an excess calorie intake. Results in symptoms like excess body fat, breathlessness, increased sweating, and constant fatigue. A balanced diet and regular exercise can help to manage this disease. If not managed, it can lead to fatal diseases like heart disease, stroke, type 2 diabetes, and certain cancers. Tooth decay is generally caused by a high sugar intake. Symptoms include toothache, sensitive teeth, bad breath, and cavities. Remedies involve reducing sugar intake and maintaining regular dental hygiene. If not treated, tooth decay can lead to serious infections. Scurvy results from vitamin C deficiency. Symptoms include fatigue, swollen and bleeding gums, joint pain, and anemia. Consuming more citrus fruits like orange and lemons can help prevent this disease. Scurvy can be fatal if not treated. Anemia is often caused by iron deficiency. Common symptoms are fatigue, weakness, pale skin, irregular heartbeat. Increase the intake of iron-rich foods like spinach and red meat to manage this condition. Anemia can be life-threatening if severe and untreated. Night blindness results from a vitamin A deficiency or a retinol deficiency. Symptoms can include difficulty seeing in low light or darkness, dry eyes, and eye infections. Increasing your intake of vitamin A-rich foods such as carrots and sweet potatoes can help prevent this condition. Night blindness can lead to complete blindness if not treated. Goiter is due to an iodine deficiency, leading to symptoms like swelling in the neck, as shown in the image, difficulty swallowing, and coughing. Remedies include increasing intake of iodine-rich foods like seafood and iodized salt. Although low risk, goiter can lead to serious complications if not treated. Spina bifida is caused by a deficiency in folate during pregnancy. Symptoms vary, but can include physical deformities and neurological problems with the fetus, as shown in the image. To manage this condition, use supplements during pregnancy, increase intake of folate-rich foods like leafy greens and fortified cereals. It can be life-threatening if severe. Rickets is due to a vitamin D deficiency. Symptoms include bone pain, delayed growth, and skeletal deformities such as bow legs. Increasing intake of vitamin D-rich foods like fatty fish and fortified dairy products can help manage this disease. If not treated, rickets can lead to serious complications. Beriberi is caused by a deficiency in thiamine. Symptoms include weight loss, emotional disturbances, impaired sensory perception, and limb pain. Increase intake of thiamine-rich foods like whole grains and pork to manage this condition. Beriberi can be fatal if not treated. Pellagra results from a deficiency in niacin. Symptoms include diarrhea, dermatitis, and dementia, and sores in the mouth. Increase intake of niacin-rich foods like poultry and peanuts to manage this condition. Pellagra can be fatal if not treated. Dehydration occurs due to insufficient water intake. Symptoms can include thirst, dry mouth, fatigue, and dark urine. To manage this, increase your fluid intake by drinking water and other beverages, and eating water-rich fruits and vegetables. Dehydration can be fatal if severe and not treated. Constipation is often caused by low fibre intake, and incidentally also by not drinking enough fluids. It leads to symptoms such as difficulty passing stools, infrequent bowel movements, and bloating. Increasing fibre intake by eating whole grains, fruits, and vegetables can help manage this condition. If not treated, it can lead to serious complications. Kwashiorkor results from protein deficiency, leading to symptoms like fatigue, irritability, and oedema. You can see on this small child here the swollen stomach, which is symptomatic of kwashiorkor. To increase your intake of protein-rich foods like meat, eggs, and dairy to manage this condition. Kwashiorkor can be fatal if not treated. Marasmus is caused by protein and calorie deficiency. Symptoms can include extreme thinness and stunted growth. Increase intake of protein and calorie-rich foods like meat, dairy, and grains to manage this condition. Marasmus can be fatal if not treated. Osteoporosis is a result of calcium and vitamin D deficiency. Vitamin D helps the absorption of calcium. It causes bone pain and fractures from minor falls. Increasing intake of calcium and vitamin D-rich foods like dairy, leafy greens, and fatty fish can help manage this disease. Osteoporosis can lead to serious complications if not treated. Pernicious anemia is due to a vitamin B12 deficiency. Symptoms include fatigue, weakness, and numbness or tingling in the hands and feet. Increased intake of vitamin B12 rich foods like meat, dairy, and fortified cereals to manage this condition. This can be life-threatening if not treated. Vitamin K deficiency leads to easy bruising and excessive bleeding. Increase intake of vitamin K-rich foods like leafy greens and broccoli and fish to manage this condition. It can be life-threatening if not treated. Magnesium deficiency. Magnesium deficiency can cause muscle twitches, mental disorders, and osteoporosis. Increase your intake of magnesium-rich foods like nuts, seeds, and whole grains can help manage this condition. It can be life-threatening if not treated. Thank you for joining us today. We hope this presentation on dietary diseases has given you an insight into how diet affects our health. Remember, proper nutrition is essential for a healthy life. We invite you to learn more about each of these diseases and how you can prevent them with a balanced diet. Stay healthy and take care of your body. It's the only place you have to live in.